Hello, and welcome to this WHBG Channel 20 special, Help in Harrisburg, a roundtable discussion presented by the City of Harrisburg. My name is Matt Maisel. For the next half hour, we will be speaking to experts about the ongoing overdose crisis we're currently experiencing in the City of Harrisburg and Dauphin County at large. We will also have a demonstration from UPMC medical professionals on how to administer Narcan, a life-saving overdose reversal drug. Since Friday, September 8th, to the timing of this taping, Thursday afternoon, September 14th, the Dauphin County 911 Center has received 29 overdose calls. 9 of those overdoses have been fatal. Each of the deceased was between 56 and 70 years old. We are very fortunate to have some of the best minds in the Harrisburg area joining us to discuss this ongoing crisis. Harrisburg Police Commissioner Tom Carter, Dauphin County Commissioner George Hartwick, Drug and Alcohol Services Director Kristin Varner, and Deputy Coroner Tommy Reinhard. Thank you all so much for joining us to discuss this very important topic. Commissioner Carter, I want to start with you. Since Friday, what have you, just the general overview, what have you seen in regards to overdoses in the city since last Friday?
It's been an unreal situation because the victims are older. They're older victims now. You know, they're from a generation where they used to use drugs and they stopped, but for some reason they started back. You know, and from when they used to use drugs and until now, it's totally different because of the different additives that they're putting into the drugs now, and their hearts cannot take this here. Their system cannot take the Narcan and the other additives that they're putting into these drugs. So, you know, they take one hit and they're out. They're out right away. And if the police or if medical personnel do not get there in a timely manner, we cannot bring them back.
Deputy Coroner Reinhard, you are seeing these bodies after they're deceased. What is different from what you're seeing now compared to what you maybe have tended to see in other drug-related overdose crises?
It appears as though this weekend these deaths appeared to be faster than normal. Can't say, but it just appeared that these were quicker than normal deaths.
Why do you think that is?
Signs that we see on the body, seen information that we got from the scenes. They like I said, they appeared to be quicker.
What are the drugs that are currently being used? Because part of what we want to do in this discussion is let people know, keep an eye out for this. If you're using, you absolutely should not, under any circumstances, be taking this. Whether we're talking about what are some of the street names going around, what are some of the drugs in general that have this bad batch, as it's been referred to. What are some of the things that the public should be looking out for?
The cocaine that they're selling now is laced with all kind of stuff. The crack that they're snorting now or smoking now is just laced with all kind of stuff. Even if they are shooting up, it is not the same. It is not the same, you know. From what I mean by not the same, it is just more potent because, you know, you take this stuff right away and you're out. You're out. You're just out. And the coroner's absolutely right, you know, like death comes upon you quickly.
Director Varner, from your perspective as the head of Drug and Alcohol Services, what is your message to people in the county, people within the city of Harrisburg who are looking for help or maybe aren't even considering help, but they see their friends and family around them dying within seconds after taking these drugs?
Correct. So treatment is a relatively easy process to access here in Dauphin County. Basically, you can go into any of our treatment providers and receive help. But if they want to come directly to our office or call our office, there's people standing by 24/7. We can help individuals determine which level of care they need. And it doesn't need to be a scary process. It's a very easy process. We let you guide us on what it is that you need. And we also have individuals that are living in recovery there to guide you through this process. So we try to make it as easily attainable as possible. And we also are there to answer the phone whenever that decision may be. So it may be at 2 o'clock in the morning, and we will answer the phone and get them right into treatment.
24 hours a day.
Yes.
When it comes to drug addiction recovery, you hear the term warm handoff a lot. Can you explain what a warm handoff is?
Sure. A warm handoff is a process that basically means that from the moment that you call, you are connected to someone the entire way through to treatment. So we use it a lot when we're talking about our warm handoff program, where we do have certified recovery specialists embedded in the hospitals when an individual is then transported after an overdose. But we're finding, especially in these cases, many of these individuals refuse treatment. So we're going to have to come up with a new plan to possibly embed them with the co-responders or embed them with the police officers, or at least have something that we can give out to the community about when and where to get help when they're ready.
How do you help someone that doesn't want help? Because you know, as an expert in this field, if we don't help you, there is a better than likely chance that you're going to die. And how do you then help someone who doesn't want that help, who isn't going to listen to you no matter what you say?
So there's usually always a very small window when that person does want help. Maybe 90% they're saying they don't. Maybe there's a small window. It opens, it closes. So we need to be ready and willing when that window opens to jump in there and say, okay, we're going to do this. And then know that it's a process, that they may not stay in long-term recovery the first time, and that's okay. And that we continue to be consistent, and we're here no matter what decision they make. And there's a chance that they may fail, but that doesn't mean we don't want to see them again.
How do people get help? Like, what's the number, email address, website, you name it? We're going to keep going back to this as we kind of have this discussion, but what is the best way for people to reach out to Dauphin County Drug and Alcohol Services to get help?
So our phone number is 717-635-2254. From the hours of 8 a.m. to 4:30 p.m., a staff member will answer. After that, the answering service picks up, but the answering service then transfers the number to a community recovery organization called Just for Today Veteran Services. And that's a group of certified recovery specialists that do the same work we do. We just contract out to them. So there's always someone that they'll talk to if they need help.
We're going to ask you to say that again in just a few minutes. I want to go to Commissioner Hartwick. Whether in your time as county commissioner or leading Steelton, you've seen the effects of this for decades now. What is different from your perspective as someone that's been around this area for so long? What is different right now compared to what you've seen in the past?
I think we sort of should reframe the discussion. I mean, we're talking about individuals that are in an overdose situation and they may not be ready for recovery. So we need to figure out how we start to talk about harm reduction strategies, because ultimately, even people who do have a window open for treatment fail on average 11 times before they actually get on a road to recovery. And there are some mindsets that are closed, some people that want to stigmatize coming to treatment, that provide additional barriers for people to be able to seek out help, because no one who is in addiction is extraordinarily proud to wake up and look in the mirror every day and go, you know what, I need to do something with my life. I'm not happy with myself. I've experienced trauma. I went through a lot. But we need to make sure that folks who are using are safe on the street today. I mean, and there are certain strategies that we can talk about. And, I equate it to, and we had this discussion earlier, I had a relative who had diabetes. No one wanted to chastise him for eating a donut, but he could have died for eating that donut. And the idea is, a drug addict, for us to be able to actually put them under a level of stigma related to their addiction versus figuring out a way to get them into some position where they've got somebody with them, they're equipped with Narcan. We're going to figure out a way that they're going to be safe. And you can't even get to the first of the 11 attempts at treatment if you're dead. So today, ultimately, we want to figure out a way to provide some level of support in folks so they can actually live to fight another day. And what the chief said and what you've heard around the table is true. Fentanyl's a killer. I mean, it's a killer. It's a known killer. And it doesn't matter if it's the opioid crisis, the crack crisis, it's laced in marijuana. there's fentanyl being circulated with multiple types of drugs. So for us to be able to talk about fentanyl testing strips, the ability to know what drugs you're taking, to be able to make sure you're with a friend who is equipped with Narcan if you're going to use, and let's get over the stigma of saying, how dare these people, they're using these drugs, and they should be cast away to the hell in society. I've got friends, family members, we all do, that have struggled with these issues. We want to make sure they're alive. And we want to make sure they live to fight another day. And in order to do that, I think there's some ways that we can help guide them in a path that will allow them to be safe in an environment where you shouldn't be taking any illegal drugs. With fentanyl around, any kind of illicit drugs have the chance to kill you today. I don't care what it is that you did when you were in college or back in the day. The point is, if you're taking it today, it's probably a lot stronger. It's not the drug that you've known, and it's probably laced with something that could probably provide harm where you can't return from. And hopefully, as a part of this panel discussion, we'll get into some tips about how we keep people alive, and then ultimately how we can drive them into some level of treatment and recovery.
All right, well, I mean, let's talk about that. How can you, whether it's with Narcan, naloxone, or other methods, what are the best ways to keep people alive in a situation like this?
I mean, Kristin, you want
Yeah,
to
so Commissioner Hartwick did mention the fentanyl testing strips, which are very important. They're relatively new for our community, being that they were just deregulated. So we have made it possible for some of our any resident of Dauphin County to go to either the RAISE project, which is at 100 North Cameron Street, or Just for Day Veteran Services, which is right on Market Street in Lemoyne, to pick up some fentanyl testing strips. But individuals need to know that they're not 100% effective. And when you're looking at them, they're about 98%, but when you're looking at the strip, one line means positive. All the other tests we use, pregnancy test, COVID test, 2 lines mean pregnant, right? I mean, positive. So we have to be careful. And, if someone's picking them up, to get that message out, what positive means. And then if they're using them in a bag of crack, they're going to have to use it in all corners, shake up that bag really well, and making sure that you're getting a very good sample. So it's almost like it's a parachute. I mean, not a parachute. It's a net, but we got to be careful with that net because it has some holes in it. And then, of course, Narcan. Narcan's very important. You can access that many different places, at the 2 places I just mentioned, and many more. There's mail order ones. You can get them at the pharmacy. You can get the RAISE Project, JFT. But those 2 alone, and having someone with you while you use. We're not condoning, we're not saying, hey, continue to use, but Commissioner Hartwick is right. And
Commissioner Carter, as of this taping, are there still Narcan doses available at the Public Safety Building?
Yes.
So 123 Walnut Street, you can come up to the Public Safety Building, no questions asked, picked up some Narcan.
Yes.
Your officers, they're the ones who are seeing this. They're essentially the first responders. When
Yes.
someone has an overdose, what is the police bureau's role in doing some of the prevention?
The prevention, well, that's a good question, but the only time we really come across an overdose victim is when someone calls us, or if we're riding through our patrol areas, we see someone down or something like that. Or my undercover operatives, they may know who these people are. So what we do right away, we interview them, we check them medically, to see just what's going on with them. If there's someone there with them, then, they'll tell us, that they overdose, or we'll see a crack pipe, we'll see a needle, we'll see a glassine bag or something like that. And then you can also tell how they're breathing, if they're struggling for air and stuff like that. So then, we administer the Narcan to them, and sometimes, it's taken multiple doses to bring people back now, because that's how strong the fentanyl and everything else that they're taking. And I believe that this stuff is coming out of Philly, and it has all kind of additives to it. I was told it's it's elephant tranquilizer, it's horse tranquilizer. It's the stuff that when you start taking it, eats your skin up and stuff like that. It's just horrible. It's not from the 80s and what have you. It's just totally different.
And Commissioner Hartwick, from a prevention standpoint, it seems like anything that we want to do in terms of prevention, there's a price tag involved with anything. But I know the county is working on different ways to get grants to help out with opioid remediation. Can you speak to what some of those opportunities are from a financial standpoint?
You know, the opioid companies have ravaged America. It didn't matter where you're from. There were people that were affected. As a result of that, there's been a significant settlement of lawsuits that went against some of the manufacturers and providers of the opioid settlement. Actually, Pennsylvania was the recipient in the first piece of about close to $1 billion. About $750 million will be distributed throughout Pennsylvania. Dauphin County was one of the first, if not the first county to get these dollars on the street. And again, our attitudes are a lot to do about this. So sort of the older generation thinks, why would you give these folks who are doing these illegal activities anything? You know, let them be in the position they're in. I believe that attitude is the wrong attitude and approach to take. I think we have a responsibility, just like in any case, to save lives and to figure out a way to give people an opportunity to make choices and to fight another day. Folks in recovery would say, if it wasn't for this time I was revived, I would have never made it to this point. So we're talking about, even with law enforcement officials, harm reduction strategies that they were usually resistant to in the past. You know, currently we've actually been able to, through the opioid grant funds, we are going to be funding 2 actual vending machines. One that's going to be available at UPMC emergency room, one available in northern Dauphin County. It's going to include wound kits for a drug called xylazine, and you were referring to that in the past. That's another opioid type of drug that leaves open scars and wounds, and if you've seen folks who use that drug, we need to have wound kits for folks to be able to address those concerns. It's going to be equipped with Narcan, fentanyl testing strips, gloves, hats. It's going to make sure that it's going to be seasonal, and it also will provide medical information, contact and prevention information as folks access this without recording you or this idea that you're somehow going to be subject to some other law enforcement activity. So we need to do a couple things. I think all of us need to understand, instead of pointing fingers, you understand there's 3 coming back at us. What is it that we can do? First of all, help somebody and support them in these cases. Make sure that they're aware of the different types of opportunities that are available to support families who are struggling through this addiction. Make sure that you get somebody who knows that they have a child who uses drugs. Make sure you have Narcan. We want to make sure that's readily available to any single individual in this county that believes that they should have it. Whether they should have it or not, they should be asking. And then ultimately figuring out a way to adapt strategies, access to some of these harm prevention and harm reduction tools to be able to ensure that folks who are using understand they should be with a friend, they should be with somebody who's capable, somebody who's equipped with Narcan. So this provides some basic advice, because a lot of times as we preach and we have this conversation on TV, we might be preaching to the choir in the homes and in rooms of folks who may not be in active addiction. But we all know folks who are in that role, and I think we can all share some of this information today to hopefully save lives out there in our community.
And it's important to know that this is not just happening in one particular neighborhood. This is affecting every family imaginable in multiple different neighborhoods. Doesn't matter, your walk of life. Tommy, I want to kind of close with you as the person who is literally seeing these people at their end. You see what these bodies look like. What is your message to people who might be thinking about picking something up? Just in general, of what your message is to them.
Sure. So certainly you must be careful of what you're getting. Like I said, the problem, the majority of problems we have now is a fentanyl. Been doing this for a lot of years, and back in the day we would have maybe 3 or 4 heroin overdoses in a whole year. So it's the fentanyl, it's the xylazine. Unfortunately, we are starting to see xylazine now being a non-opioid. That is, Narcan will not work on the xylazine. So to be even more cautious with that, it affects a lot of people as well. I was on all weekend, and I know that I spoke to over 30 family members of people that we had pass over the weekend. It affects
heroin.
It affects a lot of people. Not heroin. It's fentanyl. fentanyl, and it's in everything. It's literally in everything. The fentanyl's in everything.
And Kristin, can you provide the information one more time on
Sure.
where people can go for help?
717-635-2254.
Kristin Varner, Director of Drug and Alcohol Services at Dauphin County, Tommy Reinhard, Deputy Coroner for Dauphin County, Commissioner Carter, Commissioner Hartwick, thank you all so much for your time and expertise. We'll be right back. Minutes matter when it comes to saving a life, and UPMC is leading the way on teaching the public about health life-saving initiatives that anyone can learn. One of those we're discussing right now, and that is how to administer Narcan. We are very fortunate to be joined by Dr. Adam Barnathan, toxicologist with UPMC, and Teresa Sellers for UPMC Center for Addiction Recovery. Thank you both so much for talking with us about Narcan administration. For people who are unaware, let's just start with the general overview. What is Narcan?
So Narcan is a very interesting medication. It is used for the reversal of opioid overdoses. What it does is it antagonizes what's called the mu receptor, which is what causes respiratory depression and ultimately death in overdoses. Really, 2 sprays of Narcan can save a life.
So all you do, and I know we're going to show people how to actually do that, but if someone is overdosing, very in the most simplistic terms, you give them 2 sprays and it saves their life.
Well, I would say when somebody's overdosing, what you're going to see at the scene, which is the most important thing, is you're going to see somebody down, either slumped over in a chair, or you're going to see somebody on the floor. The first thing, of course, is scene safety, like anything. Make sure that you're safe. Call 911. The next thing you're going to do is hopefully have Narcan on you because you've obtained it through the resources that were provided, and you're going to arrive and check the patient's breathing. If you see they're breathing and they're responsive, they don't need Narcan. Now, if they're not breathing and you don't detect a pulse, go ahead and give that Narcan right away. It will work almost immediately. You will see almost an immediate response if it is an opioid overdose. You'll see that unconscious person become conscious, and you'll kind of know at that point that what you've done has worked. I mean, you'll just accompany the person until EMS arrives.
All right, Teresa, what if it's not an opioid-related overdose?
Then you've already hopefully contacted 911, and you just, again, always keep in mind scene safety and just stay with the patient. If you know basic life-saving measures, of course, proceed with that, CPR, but stay with them and keep a close eye on them, because they may then, you know, while you're waiting for 911, they may stop breathing, even though when you first approached them, they were breathing. So you just have to really be keen on observing them and knowing which way to go.
Dr. Barnathan, this has recently been one of the more active and, for that matter, deadly times in recent memory when it comes to overdoses. What are you seeing in the hospitals? We heard the segment ago about what police officers and the coroner are seeing out in the field. What are you seeing in the hospitals?
So it's a great question, because I'm seeing it from 2 aspects. I'm seeing it from the emergency department, and I'm seeing it in our clinics. And really some history of kind of this epidemic would really help to understand what we're seeing. So about 10 years ago, it was predominantly heroin in our drug supply. Now heroin is almost undetectable in the drug supply. What we have instead is we have fentanyl and fentanyl analogs. And these are hundreds of times more potent than heroin. And the reality is people just don't know what they're getting. So what we're seeing is a lot of unintentional overdoses where somebody either was recently incarcerated or recently sober and hasn't realized that the world around them has changed. And when they go to use what they typically would use, they find themselves, if they're lucky, in the hospital, unfortunately far too often at the coroner's office.
So we want to be able to show people just how easy, for that matter, it is to administer Narcan. So, Doctor, you are going to, would you like to do the example in the seated position first with Ms. Sellers, or would you like to lay on the table? Because we're going to do both examples.
Sure, so if you want to just be seated, and this is really what you'll see. And I should mention that most overdoses actually happen in the company of someone else. So it's going to be a friend. It's going to be somebody who might use. This is what you're going to see. It might be a family member. And you're going to check scene safety, your home, so you know it's safe. You're going to have an idea of what's going on. And this is the box that comes in. So this is what you get when you go to the health department and you get your resources. It comes in a 2-pack.
And right now, all I'm seeing is Teresa slumped over, lifeless body. This is what you're looking for, this type of reaction. There's
only so many interventions we could do as just bystanders from an emergency medicine standpoint. When we see somebody unresponsive, this is the number one thing we could do aside from checking a pulse and starting CPR. So this is what you might see. So I'm going to check a pulse, check to see if she's awake. Teresa. No pulse, not breathing. I'm going to open up a Narcan kit, which looks like this. And this is like called an atomizer. And you're just going to lift the chin, close the nose, and plunge down. That simple. Now you have a 2-pack, so if in 5 minutes you don't get a response, go ahead and give another one.
Important to note, 5 minutes in between sprays.
5 minutes.
That has to be the longest 5 minutes of anyone's life.
Well, I should mention that if you do not have a pulse after giving Narcan, go ahead and start CPR as you would in any other situation.
So if we're breaking this down, first thing you do, call 911. Get someone on the scene immediately. Second, you're giving that first spray of Narcan. Third, you are performing CPR or other life-saving measures to buy you some time. And 4, after 5 minutes, you're going to do what you're about to do, which is give a second spray.
It's that simple. It really is. And the reality is most people who have Narcan in the house, it's because they have a family member who uses, or they have a friend who uses, and they're going to know. They're going to know because they're going to see constricted pupils. They're going to have seen this before, and they're going to really hope that they have some Narcan in their hand, because this will save a life in that situation, and generally it will save somebody who's in their 20s to their 50s.
How long, if someone's unresponsive, 5 minutes seems like if they're not back after 5 minutes, I feel like, and again, I'm very naive and ignorant when it comes to this stuff, which is why I'm asking you. I feel like after 5 minutes, you're dead.
So the real world answer is nobody keeps a clock in these situations. 5 minutes is not really, you're not setting a timer. And the real answer is you're probably going to have some idea that this person overdosed because you're probably going to know the person's history.
Got it.
And you're going to go ahead and you're probably going to open up that second pack in 2 minutes, and that's okay.
All right, so we're saving that pack because we're going to show the other way. So in the event that someone is passed out on the ground, in this case, we're going to use this table. Dr. Barnathan, if you could kind of assume the position, and Teresa, you're going to be the one to administer the Narcan in this situation.
Here's my leverage here.
Okay, so you're out in the neighborhood, you don't necessarily know the person, and you're going to approach them. Again, scene safety is so important. So you kind of check the area. Sir, are you okay? Okay. Pulse. Unresponsive. Pulse. And again, you take your atomizer, close the one side, and spray.
Important to know, because I'm repeating this because you've now said it, and Dr. Barnathan said it multiple times. Close the one side of the nose, and then spray the other.
And then spray the other side, yes. And you should see immediate, if it is an overdose, immediate reaction that they're awake.
Got it. And it's that simple. I mean, I hate to make this seem kind of small, but it is that simple, and that action will help save someone's life immediately.
Right. And that is minutes, and that's why we're here. Minutes matter. Yeah.
For people, we talked earlier about how there is a limited supply of Narcan available at the Harrisburg Police Bureau. Where can people, when that supply runs out, because nothing is infinite, where can people go to get Narcan nowadays?
Pharmacies have it. They will run it through insurance, or there are different groups, like I heard Kristin say earlier, JFT or the RAISE Project. There are places around the community that have available resources.
Can naloxone be used the other way for someone that is looking to get high? Can it be used in that way at all, or is it strictly a life-saving substance?
Life-saving.
Got it. Okay. All right. Just, Doctor, if you want to kind of come up.
Oh, yeah.
Well, welcome back to life.
Thank you. I also want to bring up from the hospital point of view, if that's okay with you.
Yeah, absolutely.
Our ERs are the first point of contact for a lot of these patients. Not the clinic. The clinic is a great resource, but a lot of these patients that overdose, our first point of contact with them is in the emergency department. And what I always hear patients tell me, and this is true especially at UPMC facilities, is I didn't know that there was help available. And I say, of course there's help available. We have an addiction medicine service here at UPMC Harrisburg. We have addiction medicine resources. We have a clinic. And they're shocked because that is not the general experience they've had at other hospitals. So when we see them and we resuscitate them with Narcan, the first thing we talk about is treatment. And shockingly to other people who aren't in the field, these patients do really, really well when they're engaged with addiction medicine early on.
And that's where the Center for Addiction Recovery comes into play. Where can people go for more information on the center?
The UPMC website, it's UPMC Center for Addiction Recovery, and the phone number is 717-782-4781.
And we're including that number with the number for Dauphin County Drug and Alcohol Services, and also the number 1-800-662-HELP, HELP. Dr. Barnathan, Teresa Sellers from UPMC, thank you so much for joining us to shed your expertise on why minutes matter when it comes to saving a life.
Thank you.
And thank you everyone for joining us on this WHBG special, Help in Harrisburg. We'll see you next time. Take care.